Welcome to Toledo Clinic TV. Our guest for this segment is Chelsey Spangerberg. She is an audiologist, and I think right out of the gate it's important to just define what is audiology, what does an audiologist do?
Sure, so an audiology or audiology in general is the branch of science designated to study hearing and balance related issues. So as an audiologist, I am certified and trained and licensed to evaluate and treat appropriately these related issues.
Okay, and what kind of services do you offer at your clinic?
Yeah, so the Toledo Clinic ENT is very, very unique in that we actually do more of a collaborative approach. So you don't just get the audiology specialist, you also get the ENT side of things as well. So we're all under one roof. So what that looks like, if you were to come in, say, for an ear-related issue, typically we like to schedule you first with the ENT side. The reason why is if you have any type of obstruction of your ear canal, say wax, ear infections, you name it, they'll clear it and clear you for that comprehensive hearing test. Once it's cleared, you come to us for that. Now, I mentioned the word comprehensive, so it's not just a hearing screen. What this is we're actually looking at each spot of the auditory pathway going all the way up to your brain. Okay. The reason why that's important is there could be a lot going on, so it's way more in depth than just a typical screen. It gives us more pieces of the puzzle. Once that comprehensive test is done, management, it could go as far as you coming back to the audiology side to see us for hearing aids. It could be simply following up with the ENT side because now you're established with them for medical management care of that type of hearing loss. It could be as simple as monitoring your hearing and coming back annually or a couple times, out of the year or whatever. So it just varies. It's very patient specific, but we're unique in that you don't only get audiology, you get ENT as well. So that's Dr. Perry and all the advanced practice professionals there.
So let's talk about if someone comes in and they are experiencing some sort of hearing loss. Are you able to determine at that point when a hearing aid might be appropriate or when there's something that just could be used to amplify?
Absolutely, absolutely. So there's been a lot of discussion, obviously, about over-the-counter devices. A lot of times they do use the label hearing aid, which unfortunately hearing aid has become more generalized as an umbrella term. In reality, what a hearing aid should be is a prescriptive-based device. So if someone has a true, genuine hearing loss, what we do at our clinic is we prescribe these hearing aids to match your hearing loss based off your hearing test. So we take the results and we program it for your left ear and your right ear, just like glasses are for your eyes. It's the same idea. Over-the-counter devices are more so, the best way to equivalent it is readers, but for your ears. They're amplifiers, right? So they turn sound up. They don't necessarily prescribe it in any way, shape, or form to match your specific hearing loss.
Yeah, so they're not customized the
not
way
at all.
hearing aid would be.
Yeah, now they are good options for certain people, right? But before you ever do over-the-counter or a prescriptive-based device, you should always get that comprehensive test because sometimes they're not warranted. If it's simply a hearing loss that could be medically managed, that's when you go to the ENT side. So that's why we're really nice that we're an all-in-one kind of bundled package together.
And when does someone know that they need to come in and see either the ENT or see an audiologist?
Yeah, a lot of times it could be abrupt, right? Where you're like, oh my gosh, why can't I hear? And we'll get you in right away in that circumstance. Sometimes it's more, over time, I have turned the TV up. I can't hear as clear when I'm conversing in conversations. A lot of times it's the clarity. It's not necessarily, I need things louder, it's just I can't hear. Why is it not clear? Those are good key points that, hey, come in, at least get a baseline test. It doesn't hurt to check your ears out just like you do your eyes.
Yeah. All right, good advice. Thank you so much, Chelsey.
No problem.